We are live. We're live, y'all. I'm Dr. Frita, and it is Medical Monday. Welcome, welcome. This is where we talk about all of the hot health topics in the headlines. Today, we will start off with our myth versus fact. Is it true that something as simple as doing deep breathing can actually lower your blood pressure? We'll get into it, myth versus fact. And then we'll get into your weekly dose, where I give you your weekly dose of the hot health topics. We'll start off with another E. coli breakout. There's been an E. coli outbreak in carrots. Can you believe it? Organic carrots. I just released a video on my carrot ginger juice, and I love organic carrots. Anyway, be careful if you buy organic carrots, because there's been a recall because of an E. coli outbreak. So we'll talk about the signs and symptoms of E. coli and what to do if you think you've been exposed. And then we will talk about Ozempic, but not the way you think. We've been talking about Ozempic for diabetes, yes, of course. And then, of course, we've been talking about Ozempic, Wegovy, Mounjaro for weight loss. But now studies are showing, and actually some anecdotal reports from patients, that using these medications like Ozempic can help with patients who have alcoholism or alcohol overuse disorder. So yeah, it's possible that Ozempic can help you to cut back on your alcohol. We'll talk about it. We'll get into it. And then we will talk about Megan Thee Stallion. You know, she has that documentary, Megan Thee Stallion in Her Words, and she shares how she lost her mother when Megan was only 24 years old, and she lost her mother to a brain tumor. And so we'll talk about the warning signs of brain tumors. And then we'll talk about the show Full House, and one of its stars, Dave Coulier. He is sharing that he has been diagnosed with non-Hodgkin's lymphoma. What in the world is that? If you don't know, don't miss out, because we're definitely going to get into it and how you can recognize it in yourself. And then we'll talk about glucose, but not just for diabetes. Some people who are non-diabetics are starting to use glucose monitoring. Is this helpful for their health, or are they just simply doing too much? We'll discuss it. And lastly, we'll talk about Quincy Jones. We talked about him last week when he passed away at the age of 91, but now we know his official cause of being no longer with us. And so we'll get into that. And then, of course, my favorite part, the live Q&A. So go ahead and get your questions together, and I will answer them right here live and on stage for you. And make sure you go ahead, click that like button, share this video, because we're about to have some evidence-based medicine right here on Medical Monday. I'm Dr. Frita. I'll see you on the other side of the intro. Hey, we are live. I'm Dr. Frita. Let's get into this Medical Monday. We have a whole lot of topics to discuss. And as always, I will be helped by my co-host and my practice manager, Shador. Come on to the front of the stage, Shador. How are you doing, Shador?
I'm pretty good. How are you?
Doing well. Did you have a good weekend, I hope?
Oh, yeah. Nothing out of the ordinary. Nice and relaxing.
Very good. Very good. My weekend was relaxing. I was very busy. You see, I took out the braids and see what my hair is looking like going on. And so we'll see what next protective style I have. But for right now, we're just going to have the natural hair, don't care, even though it's pressed. And then we'll go on to the next thing. And then I really had a lot of relaxation, Shador. I did a lot of nothing, which is not anything I normally do. I'm usually very, very busy. But sometimes it's okay and it's good to do nothing, because that helps to relieve stress. And I'll tell you what else is rumored to help to relieve stress, Shador. Deep breathing. So first, let me see. Who's the first person in the chat today?
Yes, ma'am. Our first person today is Miss Carolyn. Hello. She says, good morning.
Good morning, Miss Carolyn. Thank you for your support. All right, Miss Carolyn, and to everyone else in the chat, let's go ahead and get started. I want to talk about deep breathing. There was an article that was recently released, and then also some coverage by some different news stations talking about how something as simple as deep breathing can really help to relieve stress. But is this a lot of mumbo jumbo? I mean, like, do we have any scientific data to support it? Well, let's talk about it in our section, myth versus fact. Okay, so for those of you who follow us, you know this is like my favorite section. So I'm going to ask you a question. And for everybody in the chat, and for those of you in the replay, I want you to get into it. Put an M if you think it's a myth, what I say, and put an F if you think it's a fact. So let's start with my first question of the day. Okay. Deep breathing only works to relieve stress if you do at least 30 minutes of meditation. Put an M1 if you think that's a myth. Put an F1 if you think that's a fact. So deep breathing will only work if you use it in conjunction with at least 30 minutes of a good meditation. M1 if you think it's a myth. F1 if you think it's a fact. Okay. And then my next question, still in keeping with the stress, I want to know if you believe that like untreated, unchecked stress can be just as damaging as secondhand smoke. Okay. Can stress be just as harmful on your body as secondhand smoke? Put an M2 if you think this is a myth. Put an F2 if you think this is a fact, because we already know we have scientific data on what secondhand smoke can do. But is it true that stress can be just as harmful? All right. So, Shador, let's pull up an article and I'll talk a little bit about it where they were talking about this deep breathing and working well and all of that. And then we'll get into our answers and give folks in the chat a chance to come on up, with their answers. So this was actually covered on this major news channel where they were saying that in a lot of workplaces, the powers that be have learned that actually doing deep breathing, doing meditation, they're actually doing them in unison, okay, at the workplaces, because they find that it helps to decrease stress. And we know that stress can cause all kinds of issues. It can cause you to have heart palpitations. It can cause you to literally have stomach problems, GI upset, even ulcers in some people. We know that stress can certainly cause you to have high blood pressure. And for those of you who are new to us, I am Dr. Frita. I'm a board certified kidney doctor and high blood pressure doctor. Okay, a high blood pressure doctor. And I can tell you firsthand that stress can cause high blood pressure. And one of the things that these corporations are finding is working is just doing some deep breathing in the workplace. It's something that they're really checking out. But is this something that has any type of a scientific data, or is it a bunch of a malarkey? Ooh, I don't know. The other thing is meditation. We do know that meditation and mindfulness, when you sit there, meditate, clear your mind, and literally just focus on nothing except for just being, getting rid of stress. We do know that meditation is something that can decrease stress. So then getting back to that first question, if you could put that up, Shador. So the myth versus fact. Does deep breathing only work for stress if you do it after 30 minutes of meditation? Okay, M1 if you think this is a myth, F1 if you think it is a fact. All right, do we have any players, Shador? Did anyone weigh in?
Absolutely, Dr. Frita. So we have Sylvia says myth.
It's a myth. Okay, Sylvia. So you don't think that you necessarily have to have 30 minutes of meditation for the deep breathing to work? Okay.
Lysandra
says it's a myth.
It's a fact.
Oh, it's a fact. Okay, so she's saying, yeah, deep breathing can work, but you better have you some meditation on board, 30 minutes. Okay.
Plant Life says fact.
He says it's a fact. Okay, deep breathing is only effective if you have 30 minutes of meditation. Hi, Planet Life. Welcome back. All right. Anyone else weigh in on this one?
KT. Hi, KT. KT
says, hi, KT. Hey, KT. Good to see you. What's KT say?
Myth.
That it's a myth. So you don't think you necessarily have to have the meditation for 30 minutes for the deep breathing to work. All right. Anyone else weigh in on this one?
Yes, we have some new ones coming to us today.
Welcome.
Janet says myth.
Hi, Janet. You think it's a myth? Okay, welcome. Make sure you hit that subscribe button here, please. We have over 800,000 subscribers here on the Dr. Frita channel. I have hundreds of videos of evidence-based medicine. And for anyone else who's listening who's new, not only am I board certified in nephrology, meaning I'm a kidney doctor and a high blood pressure doctor, I've also received board certifications in internal medicine, pediatrics, and most recently, obesity medicine. And so I give a lot of evidence-based medicine in a way that's easy to digest, easy to understand, in a way that you can share with loved ones. So we can all be healthier around here. All right, thank you. All right, anyone else before I share who's right and who's wrong for the myth
one more
versus fact?
New to us, F Forever Ruthie.
Okay. Okay. But so you think this is a myth? That's what she said?
Myth. Yes.
Okay. All right. So drum roll, drum roll, drum roll. Deep breathing is only helpful if you have done 30 minutes of meditation. This is actually a myth. It's a myth. And I thought, ooh, it's a myth. And let me tell you why. Let me tell you why. So for meditation, first of all, meditation in and of itself, you don't have to do it for 30 minutes. I know a lot of people think that you have to do 30 minutes, but if you're able to get in a corner, and especially if you're a beginner, if you even get 1 good minute in of meditation, 3 minutes in of meditation, that can already be effective in helping to decrease your stress and decrease your blood pressure. And I'll explain how and why in just a moment. But this is a myth because deep breathing alone with no meditation can help to decrease your stress and to lower your blood pressure. So if you're in a loud environment or if you're at work, if there's a lot going on and you really are having difficulty centering, people who are really pros at meditation can meditate anywhere, even in loud noises. But if you're a beginner, or if you have kind of a busy brain like myself, you need to have the place a little bit quiet to have a fighting chance. The good news is the breathing is something that you can do anywhere. It's free, it's effective, and the deep breathing alone can help to decrease stress and it can help to decrease your blood pressure. All right. Yeah, I thought that was a tricky question. I love the tricky questions. I tell you, I'm like that Rumpelstiltskin with all of the different tricks. It's very fun for me. All right, let's get into the other myth versus fact, and then I'll talk more about the science behind the deep breathing. So the other one is, if you could put that one back up, basically asking if you have unmanaged stress, can that be just as harmful to your health as secondhand smoke? Now, we know that secondhand smoke, even if you've never put a cigarette in your mouth, ever, never, ever, we know that the smoke, if you've been married to a smoker or living with a smoker, or if you're at a job where they allow smoke to be around you, we know that you can still inhale the smoke. You can be at risk for lung cancer with the secondhand smoke. You can be at risk for cardiovascular disease like heart attacks and strokes from the secondhand smoke. You can be even at risk for kidney cancer from secondhand smoke. All of that, we know that. So that's pretty detrimental. And this is a pretty big statement to say that unmanaged chronic stress can be just as harmful. So is this a myth or a fact? I wanted you to put an M2 if you think this is a myth. They saying too much, doing too much. Put an F2 if you think it's a fact. What do we get? Come on, medheads. What you got? What you got?
All right. So Sophie says it's a fact. Hi, Sophie.
Okay. So Sophie, you think that stress can be for real harmful? That's a big statement you're saying, Sophie. Let me see if you say it with your chest. All right. Who else agrees with her that it's a fact?
Tasha, aka Taz, says it's a fact.
All right. All right. Another fact. All right, Tad. Tasha.
Taz. And then we have the Gen Xer.
Gen X. Let me see. Gen X. How I feel about Gen. Wait, am I Gen Xer?
I don't know.
I'm not Gen Z. I'm definitely not millennial. Okay, Gen Xer. What you got?
A fact.
You think it's a fact? Okay, so y'all feel like this stress is for real, for real. Okay, who else?
A couple of our members have chimed in. Ms. Rosalind.
Hi, Miss Rosalind. Yay to my member. Shout out. Okay, what did Miss Rosalind say?
She says a fact.
She says it's a fact that stress can be just as harmful as secondhand smoke. Y'all talking big talk, but it looks like everyone's thinking it's a fact so far.
Well as Kim, our member, Miss Kim.
Hi, Kim. Welcome to my member. All right, so you think it's
have a myth.
Okay, who's going against the grain?
Miss Roberta.
Miss Roberta. So you're thinking if we know that secondhand smoke can cause cancer, can cause heart disease, can cause all that stuff, you're thinking no way can stress be just as bad. All right. We shall see.
And also Planet Life says it's a myth.
Says it's a myth. All right. But this one is going to trip you out because drum roll, drum roll, drum roll. It's actually a fact. Can you imagine? It's actually a fact. That's just how serious stress is. And I believe that there was a time in our medical history and as we've evolved where it was thought that stress was just something mental about your nerves. Oh, just calm down, you'll be fine. But now we see that there's so much physiology behind stress. When you experience stress, it causes your stress hormones to surge. Okay. So you can have high cortisol, high adrenaline. And here's the thing. The stress can cause your blood vessels to tighten. When these blood vessels tighten, you are literally restricting the flow to major organs. Okay. So if you're stressed out, imagine being stressed and you already have some plaques in your heart arteries. You might not even know, but you could have plaques or blockages in your heart arteries. But if you get stressed, those heart arteries tighten, boom, that's a heart attack. Same thing with your brain for a stroke. If you already have some type of plaques, cholesterol plaques, atherosclerotic plaques, and they're causing a narrowing, but you're still getting blood flow to the brain, a high amount of cortisol from stress that causes a brain artery to tighten, boom, you can have a stroke. And it goes on and on and on what stress can do. And so we now have studies to show that stress that's unmanaged can be just as harmful as secondhand smoke. But no need to fear, because there are different ways that we can manage our stress. And one way is from deep breathing. And there's a specific breathing extra. There are all kinds, but here's a specific one that I like, and it's the alternate nostril breathing. So let's roll that clip, please, and show. And I want everybody to do this with me. All right, alternate nostril breathing. Take a look at how this can decrease your stress and your blood pressure.
Deep breathing is another way to reduce your blood pressure naturally. When you do slow, deep breathing, that helps to activate your parasympathetic nervous system. It slows the heart rate. It helps the blood vessels to dilate, and it lowers the blood pressure. There are a few examples. One is breathing from the diaphragm, or diaphragmatic breathing.
Okay, let's stop this. This is not coming through clearly on my end. All right.
So it's not clear?
No, it's not. All right. So look, I'll give you a real-time sample on the deep breathing. So there's different ones you can do. Some people do what they call the box breathing, where you breathe in for 4 seconds, hold it for 4 seconds, breathe out for 4 seconds. And there's also diaphragmatic breathing. If you watch my video on this Dr. Frita YouTube channel, after you finish watching this live, then I have a video called 10 Best Exercises to Lower Your Blood Pressure the Natural Way. And so if you zoom to the part where I'm talking about breathing, then I go through different breathing exercises. I also go through meditation, mindfulness, and I talk about how it can help to lower your blood pressure. So, but here's the actual science behind it. When you do slow, deep breathing, okay, be it in a loud place, workplace, at a game, a basketball game, when the parents on the other side are talking about your child and is making you really mad, so you need to calm your stress down, you can do the slow, deep breathing anywhere. And what the slow, deep breathing does is it activates your parasympathetic nervous system. And what this does is it causes your heart rate to slow down. It causes your blood vessels to dilate, and it helps to decrease that stress, okay, to decrease those stress hormones. And I'm telling you, doing these deep breathing exercises can be lifesavers, especially now that we see that science is showing us that unchecked, unmanaged stress can be just as harmful as secondhand smoke. So y'all, let's just take a little quick minute to do this one together. The alternate nostril breathing. And this is what you'll see if you go to that video, 10 Best Exercises to Lower Your Blood Pressure the Natural Way. So basically, so this is my right hand. If you put your index finger and your middle finger together and you bend those down, okay, so you've got your thumb out there, you've got your ring finger and your pinky. Press your right thumb to your right nostril, do a slow, deep inhale, hold it, and then exhale out of that left nostril. And then you switch nostrils and you press in, okay? You press in with your ring finger on the left-hand side, slow, deep breathing, okay? You can do 4 or 5 seconds, hold it for 4 or 5 seconds, and then you release. And then you switch, and you keep doing that for like 10 to 20 rounds at first, which you can see clearly, that's not even close to 30 minutes of meditation. And you will start to feel the heart rate slow down. You'll start to feel it, okay? Oh, and make sure you consult with your doctor before trying any new exercises. So if you have some type of an issue, sleep apnea, or some type of abnormality or blockage in your nostrils, or if you're a lung patient, heart patient, consult with your doctor even before doing simple things. But if you're someone who has a generally pretty good bill of health, then the alternate nostril breathing is just one of the ways that you can decrease stress. And yes, we have science behind it. So that's it. Thank you to everyone who's bold enough to step up to the front and center and play my favorite little game, Myth versus Fact. All right, Shador. So let's get into the weekly dose of the hot health topics in the headlines. This first one makes me just want to fall off my stool, because guess what? There's been another E. coli outbreak, and it's been found in carrots, in organic carrots. And let me tell you why this makes me so annoyed. I just released a video on my favorite carrot juice. It's a carrot ginger juice. If you haven't watched it, you can check it out right here on YouTube after you finish watching this video. I have it on my Instagram as well. Okay, so I'm talking about carrots, and I had all kinds of organic carrots, and now we see there's been an E. coli outbreak. We're going to roll the clip of the E. coli outbreak in carrots. But before we do, I want you to put in the chat, those of you who remember the E. coli outbreak that we just talked about, if you remember what the source was and what restaurant was named. What was the source of this other most recent E. coli outbreak and the restaurant that was named? All right, let's look at these carrots.
Breaking news now about yet another deadly E. coli outbreak. This one in carrots sold at some of the nation's biggest grocery store chains. Adrian Broaddus joins us now with details. So Adrian, bring us up to speed.
Hallie, Grimway Farms is issuing a recall for select organic whole and baby carrots due to E. coli contamination. The CDC is reporting there have been 39 cases across 18 states. So far, there's been one reported death, and at least 15 other people have been sent to the hospital. These carrots were sold at major chains like Trader Joe's, Whole Foods, and Wegmans. Grimway Farms saying in part,
Okay, that's good.
take a role in ensuring the safety.
All right, Shador. Yeah, does it sound good on your end?
Yeah, it's fine, just fine on my end.
Yeah, it's not good on my end. Hey,
about,
can y'all do this for me? Put a 1 in the chat if you're able to hear these videos well. A 1 if you are able to hear them well. No ones. Any ones?
Not yet, Dr. Frita.
Okay, yeah. So that's okay. I'll go ahead and tell you about this outbreak. So it was found in organic carrots, the E. coli outbreak. And so for those of you who shop at places like Whole Foods, Trader Joe's, Wegmans, where they're known to have a lot of wonderful, delicious, healthy, organic foods, well, if you bought carrots from them, organic carrots, make sure that you check with the local health department. Go ahead and look it up on which carrots were recalled, because those are just some of the chains that they mentioned. And so there's been an E. coli outbreak, and there have been at least 39 people who have reported having E. coli infections across 18 states. So it looks like there's probably a central supplier, across 18 states. And there's even been one person who is no longer alive due to the E. coli outbreak from carrots. So does anyone remember what we just talked about in one of these recent lives on what was the source of another E. coli outbreak and what was the restaurant? Anyone? Any takers?
Absolutely. So our first couple to chime in was Tasha. Says onions, McDonald's.
You got it. The slivered onions from McDonald's. That's exactly right. Anybody else? I'm just curious who sits up here paying attention to little details.
Miss Sheree.
Hi, Miss Sheree. Welcome back.
Felicia also says McDonald's onions.
McDonald's onions, exactly. And so this is something, because you remember we normally, at least historically, think about E. coli mainly in like uncooked meat, right? And, we know that you can have uncooked meat, get that E. coli 015787, get a bloody diarrhea. And so now we're seeing more and more that you can also get the E. coli infection in a contamination in vegetables. All right. So, since y'all are so smart, med heads, does anyone remember any of the potential complications of an E. coli outbreak? We'll run through those quickly, and then we'll go on to our next story. Some of the potential complications. I'll jump out there and just remind you that when we talked about that story with the slivered onions, those slivered onions that were found in the quarter pounders at McDonald's, that outbreak was a mess, but especially because it caused kidney failure, hemolytic uremic syndrome, specifically in a 15-year-old girl. And yes, that's believed to be related to the E. coli infection. Did anyone else pop in with any other possible complications of E. coli infection?
Yes. Planet Life.
I had Planet Life. Nausea for sure. So what happens is E. coli is a bacterium, and it's found naturally, especially in our stool, in the intestines. But if it gets into food, if it contaminates the food, then it gets into places where it's not supposed to be. And so, yes, if you get a stomach or a gastrointestinal infection from E. coli, it can certainly cause nausea. It can cause a few other things too. Did anyone else chime in here?
Yes. Tasha says fever.
Yes, you can definitely get a fever. And that's what that young girl who ended up with the E. coli infection from the slivered onions, she had a fever in addition to the kidney failure she developed. Okay.
And TS says death, diarrhea, vomiting, and kidney failure.
Absolutely. You can get diarrhea. You can even get bloody diarrhea. And so bloody diarrhea, you can get the kidney failure. I talked about, yes, the hemolytic uremic syndrome. And you can also, of course, get fatigue. You can get dehydration, all kinds of issues if you get the complication of an E. coli infection, gastrointestinal. Now, another one, which is not likely to be from this carrot outbreak. The carrot outbreak is going to cause a similar symptoms to the slivered onions, because those people have ingested the E. coli, and now they're getting the diarrhea, the nausea, the vomiting, potentially kidney failure. But another complication we've talked about with E. coli in general is you can get honeymoon cystitis, right? You can actually get an infection in your urinary tract system, a urinary tract infection. So you just want to make sure, especially if you're someone who is a female, born a female, that you are wiping from front to back, not dragging the E. coli from back to front. You also want to make sure that after you are intimate, okay, that you get up and you urinate to make sure you don't give the E. coli a chance to crawl up your urine hole, specifically in females. For men, of course, you can get urinary tract infections as well. It's less common. And for a man who gets a urinary tract infection, it's very important that you see your doctor, because there's very likely there's something that's not quite normal going on. And you want to make sure you get to the bottom of it, be it a large prostate or something abnormal with your anatomy, or just something going on. Okay. So for men, you want to be especially active if you're getting a urinary tract infection. Okay. And, some risk factors for the E. coli is in meat. If the meat is not cooked very well, in cooking meat, you want to make sure the internal temperature is at least 160 degrees Fahrenheit. You want to make sure that you keep raw food away from cooked food. Okay, so if carrots or onions are on a slab or on a table, make sure there's no running, juice from the meat on there, or running juice from the raw fish. Keep raw food and cooked foods separate from each other. Another interesting risk factor is if you take an antacid or like a proton pump inhibitor. So if you take one of the medicines like omeprazole, Nexium, Prilosec, Pepcid, those medicines that keep your stomach acid down, that could potentially put you at a high risk for getting an E. coli infection, because you don't have enough acid to kill off the E. coli when they hit your stomach. So that's an interesting risk factor. All right. So just make sure, you watch out, see what your local health departments say, make sure you Google CDC E. coli carrots to find out if the outbreak has affected you. And again, if you bought your organic carrots from the Wegmans, from Trader Joe's, from Sprouts, then you might be at risk of having some of the carrots with the E. coli infection. So please don't eat them until you have done further research. All right. So that's that on E. coli. So for this next hot health topic in the headline, well, it actually affects one of our hottie coaches. Yeah, did y'all know we had hottie coaches? Well, yeah, Megan Thee Stallion is the self-proclaimed hottie coach, okay? Or Bad Bee, as she calls herself. You know Megan Thee Stallion. She's a singer, rapper, actor. She's won 3 Grammys. She's won a VMA. She's won a BET award. Well, we talked about how she has a documentary, Megan Thee Stallion in Her Words, where she's talked about, mental health issues, the different trauma that she's gone through, being shot in the foot, all of that. And one of the things that she talks about in her documentary, I did get a chance to watch it now. Phenomenal. I recommend you watch it. Megan Thee Stallion in Her Words on Prime. One of the things she talked about is how she lost her mother. So Megan's mother lost her life when Megan was only 24. Her mother was 47, and she lost her mother to a brain tumor. If you could just play a bit of this clip, and then we'll talk more about it.
I'm Dr. Frita. I'm a multi-board certified MD, and today I'm giving you part 1, medical messages found in Megan Thee Stallion in Her Words. Today we're talking about brain tumors, warning signs.
Okay, we'll stop that one too. All right.
That one did sound a little speedy to me.
Yeah. Like we're having a little bit of a glitchy day. But fortunately, as you can probably guess, I know everything that's in this clip. And once we're finished with this live, listen, everyone in the chat and everyone in the replay, you can actually find this video that I posted on my YouTube channel right here, dr.frita, where I'm doing a 3-part series on medical messages and Megan Thee Stallion in Her Words. This one is part 1, and it's the warning signs of a brain tumor. Okay, so I go into the warning signs of brain tumors. I give you an overview of brain tumors, and then I do some links in talking about Megan Thee Stallion and her mom specifically. But it's some good information on how you can know, because we have certain screening for certain cancers, right? We have scheduled screenings for cervical cancer for people who are ladies, people who are born female. We have scheduled screenings for breast exams, scheduled screenings for colonoscopies. And in some patients, if you're at a higher risk, we even have screenings for lung cancer. But what we don't have is a standard screening for brain tumors, right? You can go to your doctor all day long and all night long, but there's not going to be some data they pull up to say, okay, at age 40, it's time to start screening for brain cancer or brain tumors. We don't have that, which means that it's very important for you to pay attention to your body and to warning signs of brain tumors. So let me just ask my med heads. Yeah, I think I just like asking questions. Y'all know I was a teacher for just a little bit while I was in undergrad. That's something that I did. Okay, this gives me a chance to go back there. All right, I digress. So if y'all can put in the chat just a few of the warning signs that you think might be for brain tumors. What are some of the warning signs that one might experience if they're having a brain tumor? And the reason I want to do this, again, we don't have any standard screening, but I want you to pay attention for symptoms in yourself, symptoms in loved ones. And once you do check out that video, make sure you share it with the people you care about. All right, I'm putting the med heads on the spot. But did anybody jump up and give any possible symptoms of brain tumors?
Yes, Miss Sherry.
Hi, Miss Sherry. Okay.
Headache.
Absolutely. If you have a brain tumor, whether it's benign or malignant, it can cause a headache, right? Can increase pressure in your brain. And so let's just talk about that real quickly. So the types of brain tumors. Two broad categories are primary and secondary. Primary brain tumors are tumors that originate in the brain tissue. Secondary brain tumors are tumors that spread to the brain from somewhere else. For example, if you have a metastatic lung cancer and you get mets to the brain, that's a secondary tumor, okay? Metastatic lung cancer in the brain. If you have breast cancer that becomes stage 4 and it spreads to the brain, those are secondary tumors, okay? They started off somewhere else. So you have secondary tumors, but then you have primary brain tumors, which start off in the brain, okay? And then the other two sets of categories, benign and malignant. Benign are tumors that are not cancerous. Malignant are tumors that are cancerous. They can spread, invade other tissue. Here's the issue. Neither one is good, right? Neither one is good, because if you have a brain tumor, even if it's benign and it causes an increased pressure in the brain, it can cause a headache, as Ms. Cherie said. And if you get swelling in the brain, there's nowhere to go, right? The skull is very stiff, it's very hard, it's not expanding. So what happens? You get swelling, the brain has to go somewhere, and so it can herniate, okay? It can go down into the brainstem. And so here's the issue. If the brain herniates, like if it gets too big and it starts trying to leave the brain area and go down kind of in the spinal cord area, well, what happens is that a lot of the brain function, the brain or the central nervous system that's responsible for your breathing, that's responsible from your heart rate. If the brain herniates, then that area of your central nervous system will be compromised. And so a brain that's swelling and then herniates or squeezes down into the spinal canal can cause you to stop breathing, can cause your heart to stop, can cause you to be unalive. So I say that to say that even a benign or non-cancerous brain tumor can be problematic and can cause you to lose your life. Anyone else put any symptoms up here of brain tumors?
Yes, I did. Miss Rosalind.
Hi, Miss Rosalind.
Dizziness.
Yes, you can get dizziness. You can get lightheadedness. Absolutely.
Sophie says confusion.
Yes, confusion and brain fog. And in the documentary, when Megan Thee Stallion describes a phone call that her mother gave to her, she was like, I'm messing up my words. She said, I'm blanking up my words, is what her mother said. And so she was having difficulty speaking, and it sounds like she was having some confusion or some brain fog. Absolutely. Thank you.
Swansley says blurry vision.
Swansley, blurry vision, absolutely. Especially depending on where the tumor is located. If you have a pituitary tumor, pituitary adenomas are benign tumors that are relatively common as far as brain tumors go. And they can swell and they can actually cause an issue with one of the major parts of the nerves that controls your vision. So they can actually press on the optic chiasm and give you a blurry vision, or they can block out fields of vision, meaning you might be driving, you have a brain tumor and you don't know it, and you might not have peripheral vision or that side vision. And so it may seem like, oh, that car came out of nowhere and you had a car crash, but really that car coming out of nowhere that you didn't see because your vision was blocked could be a warning sign of a brain tumor. Also, you can get a brain tumor in the back of your brain, in the occipital lobe, that lobe that controls your vision, and that can cause an issue. And yes, and even just having the high pressure from the brain tumor, it can cause blurry vision. So that's 100% correct. Yes, that's one of the symptoms of a brain tumor. Very good. Anyone else?
Plant Life asks, can they get mood swings?
Yes, that's one of the ones. And if you watch that video, that's one of the things I say. Mood swings, change in personality. Okay, especially if the brain tumor is affecting that frontal lobe. That's really good. A lot of people don't think about that one. Planet Life. Yeah, that's a good one. Okay, good.
Sherry has a couple of, she said maybe family history of brain tumors.
So it's really interesting as far as malignant or cancerous brain tumors. According to the American Cancer Society, you only have a 1% chance of getting a malignant tumor. And yes, we do believe that there's some degree of a genetic component, but most people who have brain tumors will have no identifiable family history. Yeah. Okay. All right. I think we hit on most of them. Seizures, brain fog, difficulty speaking, change in personality, nausea, vomiting, certainly fatigue, weakness. You can get a right-sided weakness or a left-sided weakness if it affects the motor activity on one side or the other, be it malignant or, or even if it's benign, that can happen. And, okay, I can't help it. Okay, another trivia question. Who can tell me what celebrity's daughter recently shared her journey with a brain cancer? What celebrity's daughter recently shared her journey with a brain cancer? I'll tell you, it was a male, a retired football player.
Tasha has chimed in.
What did Tasha say?
Michael Strahan.
Very good. Yes, Michael Strahan. And I love how they shared it. So his daughter, Isabella is living with the medulloblastoma. And they shared the last update, she was doing well. She's had the surgery. Looks like she's gotten some of the other treatments as well. But I was really pleased with her. And I thought it was really brave. A young girl shared that she had medulloblastoma, which is a malignant or a cancerous brain tumor. It's actually the most common brain cancer among children. Okay. And she was 18, just about to turn 19 when she found out that she had the diagnosis. And so she had all kinds of issues, unsteady gait, like her walk was abnormal. But if you go to, I have on some of my short content on YouTube and on Instagram as well, where I go into details about medulloblastoma, specifically highlighting Michael Strahan's daughter, Isabella. Real good. All right. So let's talk about something else that can give you an unsteady gait. Okay, an abnormal walk can make you wobble when you walk. And that's excessive alcohol use. Okay, we know that alcohol use disorder is considered to be the most common preventable cause of death. Okay, a lot of deaths occur in relation with alcohol overuse, and we know that that's something preventable if you don't drink the alcohol. If you drink excessive amounts of alcohol, it can lead to liver disease. It can lead to cirrhosis. It can increase your risk for liver cancer. Okay. We know that the excessive alcoholism can impair your judgment, and you can get into a car and be driving under the influence where you can put your life at risk and put other lives at risk as well. Okay. So alcohol is something that's very serious, especially since it's everywhere, right? We don't think of alcohol a lot of times with the stigma. You go to a wedding, there's alcohol. A birthday, there's alcohol. You're, looking at your favorite show on Zoom or on YouTube, I should say, or something like that. And they're like, oh, what are you drinking? What are you drinking? Okay. It's so normalized in society, but it can cause a lot of problems. Well, Shador.
Yes.
Some recent studies are showing us that Ozempic, Wegovy, Mounjaro, Zepbound, those GLP-1 agonists, which, originally the Ozempic and Mounjaro were studied for diabetes. Then we found that they were great for weight loss. So now we've got the Wegovy and Zepbound approved for weight loss. Well, now we're seeing that there's an association with those drugs and decreased alcohol use. Okay, let's play this next clip of a mother who says that she was on one of these GLP-1 agonists, and then she realized she just didn't have much of a craving for alcohol.
We shall give it a try.
Doctors are seeing a positive side effect of those weight loss drugs like Ozempic and Wegovy, and that's a diminished craving for alcohol. CBS's Janet Shamlian looks into this in tonight's Health Watch.
You want to see this tree?
Megan Johnston started taking semaglutide last year. That's the medication in weight loss drugs like Wegovy.
You took the medication thinking, I'm going to lose weight or I want to drink less.
It was definitely that I wanted to lose weight. But, I thought if I can drink less, even better.
The 38-year-old Arlington, Virginia real estate agent says she gained 30 pounds during the pandemic and was drinking more too.
My checkup last year, I remember telling my doctor I was drinking upwards of 15 drinks a week.
And now?
Some weeks none. Last week was 1, maybe average 3.
Johnston is among many patients who've reported fewer cravings for alcohol while taking semaglutide for weight loss.
What kind of a game changer would this be?
If it turns out that this medication is safe and effective for treating addiction, this would become really the largest and most widely used pharmacotherapy for addiction medicine that's ever been developed.
Kyle Simmons is running one of several clinical trials currently underway to examine whether semaglutide reduces cravings for alcohol.
This region is exhibiting greater activity in this participant.
He says the drug affects the brain and appears to remove the pleasure received from drinking alcohol.
What would you say to people who want to take these drugs now to decrease alcohol consumption?
We just don't know yet whether or not the medication is safe and effective for the treatment of alcohol use disorder.
Johnston says she lost 45 pounds over 7 months and cut her drinking by 75%.
Do you still join your friends for cocktails or go to a bar?
Absolutely. Or I have them over and I'll make them a drink, and sometimes they'll have one and sometimes they won't.
A weight loss drug with, for some, a welcome buzzkill. Janet Shamlian, CBS News.
Okay. I find this to be very exciting news, Shador. And I'm board certified in obesity medicine. It already was a game changer when we saw that these GLP-1 agonists like semaglutide, tirzepatide, it was already a game changer when we found out that they were so great as far as losing weight. But to find out some of these other benefits has really been amazing. We know that there's studies showing that using these drugs like Ozempic, Mounjaro has been associated with a slowing down of the progression of chronic kidney disease. Okay, we have evidence to support that. We know that there's been an association with these weight loss drugs like the Ozempic and the Mounjaro. They've been associated as well with a decrease in cardiovascular events. Okay, so decreasing having a heart attack or a stroke just by being on the drug, which kind of, if you think about it, makes some sense. If you're living with obesity, that's a huge risk factor for heart disease and strokes. So if you're losing the weight, then yes, it makes sense that it could also correlate with decreasing your risk for heart attacks and strokes. But it's just that we have so many people who've used the drugs, we have hardcore data. And now alcoholism. So, or alcohol use disorder. We do know that the way that the GLP-1 agonists work, we know that, yes, they slow down stomach motility. Okay. They slow down how quickly your stomach empties. They keep you feeling full for longer, which makes you eat less. But we also know that centrally in the brain, they work because they decrease your cravings for foods. Okay. They stop you from having an appetite, but in also decreasing those cravings, decreasing that reward center for food, they can potentially decrease the cravings for alcohol. They can make it so that that reward seeking behavior is not there. And I will say, if after you finish watching this live, and for the replay crew, after you finish watching this replay, if you look at the video that I have here, I actually put this, Shador, it's been a year since I put this video out, and I talk about Ozempic, and I'm like, oh, is it the holy grail, or is it just unrealistic? A year ago, I mentioned in this video that the GLP-1 agonists were being shown to decrease alcohol cravings. So it's kind of cool that as the studies go on, it looks like that, could be something. So no, it's not FDA approved for alcohol use. And you can imagine a lot of people who have alcohol use disorder, who they, drink too much. Many of them don't need to lose weight, right? And so that will be something to figure out. Is it only if you're living with being overweight? or diabetes or obesity, then could you have the Ozempic or the Wegovy or the Mounjaro or the Zepbound approved for alcohol? We're not there yet, but we're certainly finding a lot of correlations, not just with the young lady who was on the show, but there are many anecdotal studies, anecdotal reports. I know there was one report of people who were using the GLP-1 agonist. 6 had been identified through a questionnaire of having alcohol overuse disorder. And in all 6 of them, they had a significant decrease in their use of alcohol after being on the GLP-1 agonist. That's just one small study, but there are many different anecdotal reports like that. So as we get ready to move on, if y'all have any questions about this, we'll hit them in our section at the end for our live Q&A. But if you're someone who enjoys questions and answers and going back and forth, make sure you click the link in the description and you join our membership. We have a members only community here on the Dr. Frita YouTube channel. We're having a lot of fun. If you become a member, you get certain perks like members only videos. They're videos that I release that only you see. I did another one this weekend. Ooh, what was I talking about? Oh, a little health ailment I was having. And I went through the differential diagnosis, trying to be super sleuths and figure out what I had going on. I've been talking too much. But anyway, that's for members only. I also release a lot of videos where the members will see them first. And of course, you get custom emojis, loyalty badges, and every month we do a live Q&A for the members only, or for the entire period. We're only going back and forth. I'm answering your questions. You can do follow-up questions, and you really get a chance to get my evidence-based answers on things that are going on. So go ahead, click the link in the description and join the members club. And make sure you like this video. I'm giving you evidence-based information. So like this video and share it. Go ahead and click the link, share it in your group chats, share it in your Facebooks, share it. Go tell them on the mountain. Just share this video. It lets YouTube know that we're here. For those of you in the replay, if you're enjoying this content, the replay crew, make sure that you give us a thumbs up, like this video, and share it as well. All right. So we will go on to another story, but I do want to ask this, if anyone could just give me a few. Do y'all know some of the side effects that have been reported with Ozempic and drugs like it, like the semaglutide, tirzepatide, Mounjaro, Wegovy, Zepbound? What are some of the side effects? I'll just go over a couple, and we'll talk about this, because one thing that's important, it is highly, highly necessary that if you're taking one of these weight loss drugs, that you do it under the supervision of a physician, because now it's become so commonplace that some people are figuring out ways to get it from a pharmacy themselves. I don't know if it's bootleg or if it's legal. I don't know. I'm not going to talk about it. Or they're able to order it and just take it off the line, however they're able to get it. And they're just like, oh, it's simple. It's a weight loss drug. No, there are some potential serious complications from weight loss drugs. So it's important that if you take it under the supervision of a physician. All right. I know I just threw this out there, but did any of our med heads mention any of the complications of these weight loss drugs?
Not just yet, Dr. Frita.
Okay. All right.
Oh, TS.
Hey, TS. Welcome back. Hi.
Stomach can stop working, or digestion.
That's it. And what you're talking about, TS, is gastroparesis, or a paralysis of the stomach. That's a big one that people talk about. And that's real, because for people who have diabetes, especially if they've had a long-term or some uncontrolled diabetes, they can get something called gastroparesis even without the Ozempic or the Wegovy. And that's when, you know how your stomach is supposed to have peristalsis, your stomach and intestines. That's just how the digestive system moves. It moves in muscular waves. Well, if you have gastroparesis, or like a stomach paralysis, it stops moving. And that is one of the very real side effects that can occur if you're taking one of these weight loss drugs. And so if you're a person who's had a history of gastroparesis, specifically diabetics with a history, then it may be contraindicated in you. Make sure you give your doctor your full history, okay? But that's a big red flag. If you're someone who has never had gastroparesis, it is a potential side effect. So it's something to be on the lookout for. If you start having nausea, vomiting, you're no longer passing stools, then you may have developed the stomach paralysis or the gastroparesis that TS is mentioning. Very important. That's good. All right. Anyone else?
Justin agreed. She says the stomach paralysis, but also nausea.
Yes. And the nausea can be linked to that stomach paralysis. That's a big one. That's a notify your doctor right away one. Yeah, that's good.
Right. Got a couple to say muscle loss, Tijuana.
Absolutely. So a lot of times, so when the GLP-1 agonists, okay, the Ozempic-like drugs are working centrally and they have it where you're no longer craving food, well, you also might not be craving protein, right? You may look up, it's 3 o'clock in the afternoon, you haven't eaten anything. Well, if you decrease your protein intake, then that can cause a decrease of muscle mass. And we know that's a problem because having muscle mass is something in and of itself that can help to manage your blood sugar. It's also something that, as you kind of work and you keep your muscle mass, not only does it make you look good, but it can be great for your general health. So yeah, muscle mass is a big problem. So that's why it's important to take these meds under the supervision of a physician. Most will recommend anywhere from 1,200 to 1,500 calories minimum a day. Consult with your doctor, and they'll recommend a very specific percentage of your diet that should be in protein intake so you don't get the muscle mass. That's a good one.
Mm-hmm. And Swansea agree with the muscle loss, also loss of fat in the face.
Oh, they call it Ozempic face. Okay. Or you can say Mounjaro face, Wegovy face, that bound. Yes. And guess what? That's actually also linked to a decrease in protein intake for people who are like, oh, yay, I'm not eating. And they're not getting enough protein. So when your body needs protein in order for you to make collagen and elastin, which helps to keep your face looking youthful and taut, right? So if you are not getting enough protein and you're not maintaining your collagen and elastin, you can get a sunken, gaunt looking face, okay? And it can age you. You can also get an Ozempic butt, they call it, where you start having a sagginess of the skin, okay? So if you don't just want to do it for health, do it for vanity. Make sure that you're consulting with your physician, your dietitian, and that you're getting your proper protein intake if you're on these drugs. Okay, those are good. So if you want
member only, one from our member only, Dr. Frita.
Hey, member. Who is
this? Miss Rosalind says diarrhea.
Yes, you can get diarrhea. Some people get diarrhea, some people get constipation, but absolutely that can be a side effect. Again, make sure you consult with your doctor for using these medicines. Make sure you stay well hydrated and that you don't get dehydrated from the diarrhea. Also, diarrhea can lead to low potassium. So you want to make sure that if you're having diarrhea, you follow up with your doctor to make sure you don't need to either increase potassium in your diet or take a potassium supplementation. That's really, really good. All right. So we'll move quickly to these last couple of topics. I will say that if you want to find out more of the complications, I go into them complication by complication in detail in my video right here on this Dr. Frita YouTube channel where I talk about Ozempic. So if you just go to the YouTube search bar and you put Dr. Frita Ozempic, it'll pop up and I go into detail. All right. So, okay, put a 2 in the chat if you're familiar with the show Full House. If you're familiar with the show Full House. And oh gosh, they actually had one of their stars who lost his life, okay, to head trauma. And oh gosh, I was on a national news show talking about it right after it happened. Yeah. Well, now they have a different star from Full House who has shared that he is living with non-Hodgkin's lymphoma. Okay, Dave Coulier. All right, let's go ahead and roll that clip.
Morning to share some news that you've been wanting to share for a little bit now. It's some news about your health.
Yes, 5 weeks ago, I was diagnosed with stage 3 non-Hodgkin's lymphoma. And in that time, I've had 3 surgeries. I've had chemo. I've lost a little bit of hair. I kind of look like a little baby bird now, but it has been a roller coaster ride for sure.
Full House star Dave Coulier revealing his stage 3 cancer diagnosis.
Life has its ups and downs.
The actor stopping by the Today Show to open up about his cancer battle, sharing details about how he found out.
This is B-cell lymphoma that I have. It's a very aggressive type of lymphoma, and it happened very quickly. The onset of this growing lymphoma in my groin area was very quick. So I said, something's not right. I have a golf ball down here. And so we biopsied it. We took it out. And they said, we wish we had better news for you, but, you have B-cell lymphoma. We need to get you into chemotherapy right away.
The hardest person for Dave to break the news to, his wife, Melissa.
I was home by myself. She came home 20 minutes later and she said, have you heard anything? And I said, yeah, I have cancer. And she said, "Come on, quit making jokes." And I said, "No, I did." And once that settled
Okay.
in, a gut punch.
Yeah, and that kind of hit me when he said that his wife was like, "Stop making jokes," because you can tell he's a person with a good sense of humor.
Mhm.
But cancer is definitely not funny. So we'll just speak real briefly about non-Hodgkin's lymphoma. So we all have lymphatic systems. Okay, it's not really something that comes up in everyday work lunch conversations or at the dinner table, but your lymphatic system is composed of your spleen, your thymus, your tonsils, your adenoids, the lymph vessels. And non-Hodgkin's lymphoma starts in the lymphatic system. It's a part of your immune system, the system that helps you to fight infection. So with non-Hodgkin's lymphoma, you get malignancy and abnormal growth and spreading of some of these white blood cells, specifically your lymphocytes. Okay. And he discussed the way that his presented was that he had a golf ball size lymph node. Okay. And we all know what lymph nodes are. If ever you were sick, you have a cold and a sore throat, you feel those little balls, little nodules, little knots that grow. Sometimes they're tender. Those are lymph nodes. Okay. And if you get an infection, those lymph nodes will grow and your immune system is kicking in trying to fight the infection. You can also get them in the groin. Like you said, they're not going to be the size of a golf ball typically, maybe just little knots in the groin. You can get them in the underarm. So for people with non-Hodgkin's lymphoma, the large golf ball size lymph nodes might present neck, underarms, groin. Okay. And his presented in the groin. And so there are different types of non-Hodgkin's lymphoma. Some of the more common ones are diffuse large B-cell lymphoma, follicular lymphoma. There's you have B-cell types, you have T-cell types. Bottom line, this is another one of those cancers, those malignancies where there's no standard screening, okay? There's no colonoscopy, pap smear, prostate exam for non-Hodgkin's lymphoma. And so this is another case where you just have to be aware of the warning signs. So again, the warning signs include enlarged lymph nodes, especially ones that just aren't going away or that perhaps aren't even moving much. If you're suspicious, go in and talk to your doctor. You might get fatigue, you might get abdominal pain. Okay. So non-Hodgkin's lymphoma is something that Dave Coulier is now living with, being treated for. And so certainly my prayers are going up for him that he does well. And I suggest that you go look more into this story. And if in me talking, if you're thinking, oh, I have had some really large lymph nodes that don't go away, or I have been fatigued, or I have had an abdominal mass, I've had a fever, I've had night sweats. If these things are starting to pop up in your mind, consult your doctor right away, because it could be a sign of non-Hodgkin's lymphoma. Okay. And so for these last couple of stories, we'll just breeze and run through, because I do want to get into a couple of Q&As if we have time. Again, remember, join the membership if you want to have a full session of a Q&A with me. It's members only for the entire session once a month. And again, for the members, you get videos that are members only. I'm posting those on a regular basis, and you're getting other VIP perks. If you don't join the membership, don't worry. I'll still be on here giving you the evidence-based medicine that you love. Don't worry, I'm not taking from you. But if you want just a couple of more VIP perks, then come on and join the membership. Also, if you want to do a one-on-one consultation with me, where you really want to get an opinion from me, first opinion, second opinion, then make sure you click the link in the description, because I do offer a telehealth concierge service. We've been having a very good response, and I'm booked and busy with these, and I'm enjoying it, because that means that I can talk to you wherever you are in the world. Okay, we can talk about your health, and I use my knowledge about kidneys, high blood pressure, the certifications I've had in internal medicine, pediatrics, obesity medicine, to really give you an evidence-based, easy to understand recommendation based on your history. So click that link in the description for that as well. All right. So just real quickly, and do we have an article, Shador, for the continuous glucose monitoring?
There's an article and there's a video.
Okay, let's put the article up, and I'll talk about that real briefly. So some people are using, you've heard, for people who are diabetics, we have the AccuChecks, right? Or continuous glucose monitoring, so that people who have diabetes can have a better blood sugar control. Well, now we have some people who don't even have diabetes who are using continuous glucose monitoring, because they're thinking, hey, this can keep me from ever getting diabetes, or it can let me know which foods I eat that are shooting my blood sugar up. Some people who thought that oatmeal was great for them are eating the oatmeal, and they're finding that their blood sugar is shooting up. And so the big question is continuous glucose monitoring something that's necessary for people who don't have diabetes? Or is it just something that's going to create extra anxiety and be nerve-wracking? And there are different opinions out on it. There's one physician who talks about how when she was pregnant, she didn't want to get gestational diabetes or diabetes while you're pregnant. And she didn't have diabetes, but having that continuous glucose monitor for her actually became too much, and it caused her to not eat enough in her pregnancy. Okay. But it just kind of depends. And so we'll come back and talk more about that. But I do want you to go ahead and put a 3 in the chat if you think that's doing too much, continuous glucose monitoring if you don't have diabetes. Put a 4 in the chat if you think, that's a good idea. Maybe I'll do it even if I don't have diabetes. 3, you're doing too much. 4, you think it's a good idea. I'm just curious. All right. So while they're putting that in, let's put up the Quincy Jones, and then we'll do just a couple of questions from the live Q&A.
Right.
Yeah, I talked about Quincy Jones last week, and we know that he had multiple medical problems. He dealt with brain aneurysms, he dealt with diabetes, and I talked about those strokes. He's had those. So make sure after you finish watching this live or this replay, make sure you go back and watch last week's for that. But now his official cause of death has been revealed.
Quincy Jones died of pancreatic cancer, according to his death certificate released by the Los Angeles County Department of Public Health and obtained by TMZ Wednesday. There were reportedly no other factors contributing to his death. Pancreatic cancer is the third leading cause of cancer deaths in the United States, according to the National Cancer Institute. The legendary music producer did not reveal he had cancer before he died at 91. Jones passed on November 3rd, surrounded by his loved ones in his Los Angeles home.
All right. So yes, he passed away with pancreatic cancer. And the pancreas is that really drumstick shaped organ that's in like the top of your stomach, the epigastrium, and right below your ribs in the front. And your pancreas is responsible for making certain hormones like insulin. It helps to make other hormones that are good for digestion. And it used to be the 4th leading cause of death, at least like 6 years ago. So now it sounds like it's the 3rd leading cause of death. If you want to learn more about pancreatic cancer and some of the warning signs like yellow eyes or jaundice, fatty stools, pale stools, then once you finish watching this video, check out my video right here on the Dr. Frita channel where I talk about pancreatic cancer. I did that video soon after Aretha Franklin passed away because she passed with pancreatic cancer. So, still our thoughts and prayers go up to Quincy Jones and his loved ones. He definitely was an icon and a legend in the music industry. All right. Anybody put any 3s or 4s before we go into a quick live Q&A?
Yes, of course, Dr. Frita. We have a 3 from Shar.
She said she think they're doing too much. Okay. Hi, Shar.
Roberta says gave a 4.
Okay. So maybe somebody, especially someone who's at high risk for diabetes, someone living with obesity, strong family history, maybe even someone whose hemoglobin A1C is between 5.7 and 6.4, which puts you at having pre-diabetes. Okay. So maybe with a couple of qualifiers. Okay.
Penny says 4.
4. Okay.
Sheree says too expensive if you don't need it.
So now that's some smart thinking. So if you have all of these people who are getting continuous glucose monitors and it's being covered by insurance, are there going to be cuts other places where they go up in price in insurance or up in price? Okay. So you're getting into the healthcare because it is expensive, in the big picture. So that's interesting. Maybe if there's certain regulations, like if you're someone who's at high risk or if you have pre-diabetes, but as far as like that doctor who just didn't want to get gestational diabetes, and I imagine that she didn't have any strong risk factors, but she was just doing it, then perhaps in someone like her, have certain stipulations and say, no, you're pretty healthy. It's not necessary. But perhaps someone who's high risk, even if they don't have diabetes yet, maybe that could be some little margin. But just for any and everybody, people who are at healthy weights, healthy cholesterol, healthy everything else, that might be just doing too much and that might be weighing too much on the healthcare system. That's a good point. Good point. All right. As we get ready to slide out of here, I want to see if we have any questions. Make sure you go ahead and hit that like button, share this video. Y'all in the replay, I want to hear from you also. And if y'all have any questions in the replay game, we might see them and put them up the next go round for our live Q&A. But try to join us. We're at noon Eastern Standard Time on Mondays. Come on, you can come peek at us during your lunch break. All right, any questions before we head out?
Yes, we have not had this question before. This comes from Miss Sherry.
Hi, Miss Sherry.
What are some root causes of neuropathy when diabetes or prediabetes is not an issue?
Ooh, that's good. That's good. So yes, so we know that one of the big causes of neuropathy, peripheral neuropathy, getting the tingling or the numbness of the fingers and toes. We know that having high blood sugar is one of the common ones, but there are some other causes as well. Certain medications can cause you to have a neuropathy. Specifically, certain chemotherapies can cause you to have a neuropathy. Also, infections or certain infections that can cause you to have a peripheral neuropathy. Some people with HIV, especially if it's poorly controlled, can get a peripheral neuropathy that's associated. Okay, so certain infections can do it. So those are the main categories: medications and infections. And then if you have a neurological disorder, like a genetic predisposition. And it might not be the very classic one, the fingers and toes tingling, but you might have, you might be trying to walk and then you have a difficulty with your gait, or you might notice one of your legs goes numb or one of your arms goes numb. So something like a multiple sclerosis can cause you to have issues like that. Certainly autoimmune diseases, the diseases where your antibodies, instead of just fighting bacteria and germs, the same way an autobiography is a book about oneself. An autoimmune disease is when your antibodies attack oneself, where you have that can get quite vast. You can have autoimmune diseases, even something like lupus, which classically we think of as causing joint pains or skin rashes, things of that nature, lupus nephritis, kidney disease. But something like a lupus can even cause issues with the nerves or a neuropathy. And so if you're having a neuropathy and you don't have diabetes, definitely you want to consult with your primary care physician. And I would ask your physician about some of the things that I've mentioned. Certainly what I give is just information. It does not replace the advice of your primary care physician. But I would say, could I have multiple sclerosis? Do I have an autoimmune disease? Let's take a look at my medication history. Have I been on one of these medications that can be associated with neuropathy? I would start there. And depending on what your primary care physician is able to uncover, they might refer you to a neurologist who can give you a complete workup to find out about the neuropathy. That's a great question. You're right. We have not had that here before. Thank you.
You're welcome. And then from our member only, Miss Rosalind chimed in with your answer regarding that. She says, my causes were 2 back surgeries and several months of neuropathy, both feet, hands.
That's tricky. So a back surgery so from your back, your spinal cord, you have all kinds of nerves that come off that help you to innervate, or they cause your nerve function in the rest of the body. That's why some people who have back pain and they get sciatica, they find that their leg is very painful or weak. Even a neck surgery, right? Your cervical spine it has nerves that go off and control the function and the numbness, tingling of your hands. So if you've had a neck surgery, that can cause you, depending on what issues you have, to have a hand, arm, finger weakness. So that's very good, having an issue with the back. So be it, degenerative joint disease, be it a herniated disc, be it, whatever the cause, a tumor even, then yes, that's a good point. A back surgery or even a cervical spine neck surgery or back injury, neck injury can cause issues with your nerves peripherally, all the way to the hands, fingers, feet, and toes. Thank you. That's a good point.
All right. And I hit one more question, Dr. Frita, then a comment for you. This question comes from Tasha.
Hi, Tasha.
It says, is it a myth that heavy alcohol use can cause high diastolic blood pressure numbers?
Oh, that's not a myth. In fact, alcohol use is one of the risk factors for hypertension. If you check out my videos right here on this Dr. Frita YouTube channel, and I believe I have a playlist. If not, if you just put Dr. Frita hypertension, you can see in different videos where I talk about alcohol and how it affects blood pressure. And I also have a very specific video on alcohol where I talk about the dark side of alcohol, and I talk about the different complications. Hypertension is one of them. And yes, it can cause specifically a diastolic hypertension. And so let's just quickly talk about alcohol use, because like I said, alcohol is everywhere. So who knows how much is too much? I know because the CDC has outlined it. And so it is considered to be excessive alcohol use if you are a female and you drink 8 drinks or more in a week, or if you're a male and you drink 15 or more in a week. I didn't come up with the gender differences. I don't even know. But basically, what's considered, so basically for women, they're saying 1 drink a day, or for men, no more than 2 drinks a day. Okay. You decide how you want to use this information. This is what the CDC says. But more importantly, what is a drink? A drink is not a big old 16-ounce tumbler full of dark liquor. Okay, if you have one of those, that's more than 1 drink. A drink is considered to be 5 ounces of wine, or 12 ounces of beer, or if it's a stronger, like harder liquor, like an 80 proof alcohol, 1.5 ounces. And you know, good and well, when y'all are at the house parties, nobody's pouring just 5 ounces of alcohol. Okay. So one of your drinks might end up being 2 or 3, but having more than 1 drink a day for women, more than 2 drinks a day for men, or the 8 drinks a week, 15 drinks a week, that's considered to be alcohol overuse. And yes, it can absolutely be associated with hypertension, specifically diastolic hypertension. It can also be associated with a dilated cardiomyopathy. Yes, there's a heart disease associated with the alcohol use, and neuropathy. Alcohol overuse can lead to neuropathy. And of course, it can lead to cirrhosis, bleeding disorders, esophageal varices, where you can get bleeding varicose veins in the esophagus. Just, you know, if you drink alcohol, consult with your doctor if you're having any overuse, and even ask your doctor about this new study, this new information that's coming out with the Ozempic, if it's something to help decrease the use of alcohol. That's a real good question.
Yeah, very much so. All right, Dr. Frita, well, I have love for Ethiopia. Send you some love.
Yay, all the way from Ethiopia. Oh,
thank you for always bringing very important topics.
Oh, thank you so much. And thank you for your support. I appreciate that. From Ethiopia, yay. And I appreciate all of you who hang with me here in the chat. I appreciate those of you who are watching us in the replay. We appreciate you. Please, before you leave, make sure you like this video, you share it with the people you care about, and we will keep coming on here and giving you hot health topics in the headlines, okay? And make sure, check out my Instagram at dr.frita. I have different content there than I have on YouTube. Also, click the link in the description. And if you have not already, check out my book, Under Pressure, A Guide to Controlling High Blood Pressure. I give evidence-based medicine, not only on medications that treat blood pressure, but also on holistic measures, lifestyle, using food as medicine, all of those things. And check out my favorite things. If you go to dr.frita.com, I have my favorite things where I have the blood pressure cuff I like to use, my favorite juicer, all of those things. I'll be putting some more things up there too. I'll try to get some up maybe even before the Christmas holidays, some gift ideas, some healthy gift ideas. All right. Thank you, Shador, for being a wonderful, wonderful co-host. I appreciate you very much. And we will see y'all next week for another Medical Monday right here, live and on stage. All right. Y'all have a good week.
All right. Bye, everyone.